The DSM stands for the Diagnostic and Statistical Manual of Mental Disorders, and it's the big book that psychologists use to diagnose mental illness. There's a lot of different disorders in that book, and we're only going to cover a few, but you will want to know the 5 axes of the DSM. And this is simply 5 different ways of classifying conditions in a way to diagnose and help someone. So we'll go through each axis. You'll want to know what's on each axis, and you'll also want to be able to identify an example and label what axis that example would fall on. So most of the topics that we cover in psychology actually fall under axis 1. Axis 1 contains most psychological disorders. So your mood disorders like depression, your anxiety disorders like obsessive-compulsive disorder, schizophrenia, bipolar disorder, post-traumatic stress disorder, dissociative identity disorder. All of these are axis 1 disorders. So axis 1 is where most psychological illnesses will be labeled. Axis 2 contains a few things, but primarily it contains personality disorders. Now, personality disorders are a little bit different from most psychological disorders in that your personality is a large part of who you are. Remember, personality are those relatively stable ways that you think, feel, and behave. So if we're treating personality, that's usually a much more involved process. It's not to say you can't get help for a personality disorder. You absolutely can, but it's a little bit different type of therapy than treating depression or treating anxiety. So axis 2 involves your personality disorders. Axis 3 is where we would label a general medical condition. And you might ask yourself, well, why would a psychologist want to know what's going on with someone physically? Well, there's many reasons. One of which is that a lot of times mental health symptoms can arise from a physical concern. Let's say that you have just been diagnosed with cancer. Well, it might not surprise you that some people might develop depression or they might have anxiety about upcoming surgeries. So you want to know as much about what's going on with someone's physical health as you can. Not only that, but if a psychiatrist is going to prescribe medication, they'll want to be familiar with your general medical conditions so they know what other prescriptions you might also be taking. So axis 3 is where we put any kind of physical information. Cancer, asthma, a broken back, anything physical would go under axis 3. Axis 4 is what we call psychosocial functioning, which just means your life. This is where any kind of life stressor would go. If you've just been fired from your job, we'd put that on axis 4. If you have just broken up in a relationship, that's axis 4. If you have some positive life-changing news, that can go under axis 4, because positive life events can cause stress too. Some of you are parents, and while the birth of a child can be beautiful and miraculous, it also comes with a lot of life changes like loss of sleep and stress. So anything positive still might go under axis 4. Any kind of life situation that could impact your mental health goes under axis 4. And then axis 5 is where we put your GAF, which stands for Global Assessment of Functioning. And basically this is a score from 0 to 100 of how well the psychologist thinks you're handling everything. How well are you coping? How well are you functioning? So obviously this is a little bit more subjective than some of the others, but again, there's not always widespread agreement on what diagnosis someone will have. So make sure for this outcome that you know what the DSM is and that you know the 5 axes and the types of conditions that would be placed upon them.